So back in Virginia, I was treating this patient. She had come in brand new. Her complaints were knee pain, knee arthritis. And what I was explaining to her is that, we need to start exposing the knees to a little bit of load because the body is very good at adapting to load. So she was very, very afraid of moving because of the arthritis, and she felt like the more she rested, the better off she would be. But she had been doing that for years, and it just continued to get worse, which is kind of status quo. So what I was saying is we need to start exposing the knees to some exercise, and I was explaining some of the exercises that we would start doing. And what the studies say is that runners have the least amount of arthritis out there of any cohort. And if you already have arthritis and you start doing a small running program, people actually end up with less x-ray progression of their arthritis and better symptoms than the group that didn't continue to run. So I was explaining all this to her and saying, we're going to start you on a running program where we start with just some light hopping to get your knees exposed to a little bit of load, and then we can start progressing to more walking and then eventually a little bit of running. She thought I was just absolutely bonkers. So she protested against it, and I said, well, we'll talk about it. And then on the way out, I was walking her out of the office. There was a client in the waiting room who I hadn't seen in years. And I was wondering if she had an appointment. I said hi to her. And she said, I just wanted to come in and let you know that my knees have been better than they've ever been for years, despite injections and all this other therapy. And the reason that I think they're better is because 2 years ago, you told me to start a small running program. So every week now I run about 4 or 5 times for about 2 miles, where I walk for 2 minutes and I run for 1 minute, and I walk for 2 minutes and I run for 1 minute, and I do that for 2 miles. And my knees have never felt better than this. I can walk up and down the stairs painless. And this other patient who I just told this idea about running, who said she was not going to be coming back, looked at me and she's like, well, you just planted her here. And obviously I hadn't planted her. It was just such an interesting little dynamic where she was just telling me this story about how great she was doing in front of this other patient who told me that I was a bit cuckoo for wanting her to do this whole thing. So it was an interesting story.